Hello, everyone, and welcome to another stop along the Mount Nittany Health 2020 virtual tour. We've been taking you behind the scenes at some of the most high-tech spaces across our health system, and today we're back with Nicole Young, a physician assistant with Mount Nittany Physician Group Cardiology, Vein Vascular Clinic. So welcome, Nicole. It's great to see you here.
Hey, Leanne. Thanks for having me.
Okay. Today, Nicole is going to talk about conditions and treatments related to the Vein Vascular Clinic. If you have a question today for Nicole, please go ahead and drop it in the comment section below, and we'll do our best to get to those during our short time together this afternoon. Nicole, let's start by introducing you. Can you please tell us a little bit more about yourself and what you do here at the Vein Vascular Clinic?
Sure. Hi, everyone. It's a pleasure to be here. My name is Nicole Young. I'm a physician assistant in the cardiology department at Mount Nittany. I see general cardiology patients, but I also have a unique role here. I specialize in vascular medicine. That involves the diagnosing and treatment of disorders involving arteries and veins outside of the heart. My role here includes seeing new patient consults, performing follow-up visits, and assisting in procedures. We've been working really hard to expand our services, and we're really excited to be able to provide more comprehensive cardiovascular care to the community.
Okay, very good. That's interesting. You mentioned vascular medicine. I'm not sure that many of our viewers really know what that is. So can you tell us, what type of patients you see in the vascular medicine field?
Yeah, that's a great question. So we see a wide variety of patients. Common things that patients are suffering from include leg pain, heaviness, like swelling, varicose veins, spider veins, skin discoloration, itching and bleeding from veins, and slow healing sores. So when we talk about vascular medicine, I think that it's helpful to kind of break it up into two categories: disorders that involve the arteries and the veins. We see a lot of vein disorders here at the clinic. The most common thing we treat is something called chronic venous insufficiency, which basically is a medical term meaning leaky veins. When you have spider veins and varicose veins, some people don't realize that can be a sign of underlying leaky veins. This is a really common problem. It affects actually about 45 or 40% of the population. And what happens there is that the veins, they are returning deoxygenated blood back up to your heart. They have a hard job, especially in your legs. They're working against gravity. So they have these things in them called valves, essentially, that help push the blood up towards the heart. Over time, for a variety of reasons, sometimes pregnancies, genetics, standing for long periods, all those factors can contribute to this, but those valves become inefficient. This causes blood to flow forward towards the heart and then backwards. When that happens, the blood pools in the legs and then can cause a variety of symptoms, again, like heaviness, swelling of the legs, the outward signs of the varicose veins and spider veins. This isn't a dangerous process, but can be quite bothersome to patients. I often will see patients who maybe the original reason they come to see us is because they don't like the appearance of their veins, but then as we talk, they realize that those veins may actually be the reason their legs feel heavy and swell, and they didn't even realize that. Arterial disease, on the other hand, is we're usually talking about the arteries in the legs specifically, but it's similar to heart disease in that you get cholesterol plaque buildup in those arteries. When that happens, that results in narrowing or blockages in the arteries. When this happens in the legs, it can cause pain in the legs. Most common, this is a pain that people get with activity, and then it is relieved with rest. So common scenario would be somebody comes in because they walk a short distance, such as to their mailbox, their legs hurt them significantly, they have to stop and take a break. That's something too that sometimes they have lived with for a long time and have maybe attributed it to back issues or other orthopedic issues. It's important to know if you have arterial disease because that puts you at a higher risk for having heart attack and stroke as well.
Okay, very good. So those are some of the patients and the conditions that you treat. Once again, joining us live from the Mount Nittany Physician Group Cardiology, Vein Vascular Clinic and State College. This is a relatively new clinic, recently opened to serve those vein and vascular patients. Wondering if you could tell us a little bit more about the services that you offer in that clinic.
Sure. So we are excited that all of our vein treatments are performed here in our office, which is located Mount Nittany Physician Group Park Avenue location. It's right across from Mount Nittany Medical Center. And here we're able to provide a variety of treatments for vein disorders. We work with the patients and utilize some kind of imaging, typically like an ultrasound, to decide what's the best treatment course for them. All of our vein treatments are performed in the office. Again, they're minimally invasive, not painful. A local anesthetic is used. There's little to no downtime. Typically, patients come here to the office. Their procedure is done in less than an hour. They go back to work, back to normal activities. So it's a really simple procedure. And the best part, too, is most insurances cover all of these procedures. The more advanced procedures for treatment of arterial disease, which includes anything from angioplasty, atherectomy, and or stenting, those are performed at the state-of-the-art cardiovascular pavilion at Mount Nittany Medical Center.
Mm-hmm. Okay, very good. Just a follow-up question to that. Wondering if you can talk to us a little bit more about how some of those procedures work. Some of the ones that you mentioned in the office, like a venous seal or an ablation procedure. How does that work to treat varicose or spider veins?
Yeah, that's a great question. So there's been a lot of advancement in the treatment of varicose veins. So again, we have lots of options that I think people don't even realize are available for treatment of varicose veins and spider veins. Again, all performed here in the office. One that we commonly do is called a venous seal ablation. It's basically a medical adhesive that we inject into the diseased vein to essentially glue that vein closed. The goal of any of these treatments is to reroute blood flow and force the circulation to utilize healthier veins. We also perform a procedure called a radiofrequency ablation, which is similar but utilizes heat to just essentially burn the vein closed. We do a lot of sclerotherapy, which involves injecting a solution into the veins that causes the veins to collapse and basically disappear. As far as treatment for arterial disease goes, that again is performed over at the medical center, still typically an outpatient procedure. We perform angiography, which involves injecting contrast dye into the arteries under continuous X-ray to actually take specific pictures and be able to visualize the blockages and narrowings in the arteries. Then if we need to perform any intervention, we can insert balloons into the arteries to expand the plaque open. We can perform atherectomy, which basically removes plaque and calcified plaque. And then we also can perform stenting, which basically involves inserting a small mesh tube into the artery, expanding it to help keep the artery open.
Okay, very good. Thank you for reviewing all of that. As a reminder, we're live with Nicole Young. She is a physician assistant with Mount Nittany Physician Group Cardiology. We're specifically talking about services today that are available in the Vein and Vascular Clinic of that practice. Nicole, I have a question for you. I'm wondering if there's any advice that you might give to our viewers tuning in today who might be considering treatment for varicose or spider veins.
Yeah, I think the best advice is, if you're considering that, don't delay having a consultation, especially if you're having any of the symptoms that we discussed. Again, varicose veins, spider veins can be a sign of that underlying vein insufficiency or leaky veins, and maybe contributing to leg heaviness, swelling, and we have lots of treatment options available that can not only improve the cosmetic appearance, but make the legs feel better. We are accepting new patients, happy to see patients. You can call our office. You also can visit. We have a website that you can actually email us directly from there and set up an appointment.
Great. We'll be sure for our viewers today, we'll be sure to post all of that information in the comment section below for today's live chat. Just going back to something you mentioned before, you mentioned some symptoms of varicose veins that patients should watch out for, like heaviness and fatigue in the legs. Wondering if you could tell us again what causes those symptoms to happen. And I think this is going back to what you're saying about blood flow.
Yeah, so again, the veins are what carry the blood back up to the heart, and in the legs, they're working against gravity. It's a more difficult job to pump the blood back up, and it's really common that the blood flow is inefficient over time because the valves in these veins kind of fail. So we can actually see under ultrasound is that the blood flows forward like it should, and then we can actually measure it flowing backwards, and that causes the blood to pool in the veins and can lead to all these symptoms that you just mentioned, and then again those outward signs of this process, such as the varicose veins. Emphasizing it's not a dangerous thing, but can lead to a quality of life issue for patients.
Great. So that pooling of the blood that you mentioned, is that what causes the vein to bulge, essentially?
Yep.
Okay. Very good. Thank you. We do have some viewer questions that we received ahead of today's live broadcast, so I will go through those next. The first question is this, and it's something that you touched on earlier. It's a simple question. Are varicose veins dangerous? Should I be concerned?
Yeah, it's a great question. So, again, varicose veins aren't dangerous necessarily, but they can be a sign that the veins are just not working efficiently or properly, and can lead to symptoms that, again, patients may not even realize are from their veins, like the leg heaviness, the swelling, the varicose veins, discoloration of the skin, itching of veins. If the vein disease gets advanced enough, we actually see ulcers and sores in the legs that are caused from these veins. So, not dangerous, but something that can really affect quality of life.
And is the first step then to call in to make an appointment to have a consultation to see what can be done for the patient?
Yeah, so typically when we see a patient in consultation, we'll talk to them about what's going on, what concerns they have, do an exam, and then we always obtain an ultrasound, which is done right here in our office. We have vascular techs who are great at this, and they're able to actually see all those veins and help how they're functioning. That helps us formulate a plan.
Okay, great. So first step, if you have those varicose veins, especially if you're having symptoms, just to repeat back what you said, would be to call the Vein and Vascular Clinic and see about an appointment to have a consultation and make a plan for your care. Very good. Another question for you, is spider vein treatment painful? So spider veins, I guess we should clarify for our viewers today, are these smaller, kind of spindly looking, they look like spider webs. That's how they get their name, right?
Yeah, exactly.
And that's based on what you said, it sounds like that's more of a cosmetic concern, but they can be treated, right? And tell us a little bit about that treatment. Is it painful, and what all does it involve?
That's a question we get commonly, not just with the spider vein treatment, but with treatment of any varicose veins. And even when we're doing the bigger procedures for the varicose veins, again, that's just a local anesthetic that's used. So there's usually just several needle sticks at most. I like to call them bee stings. So patients are typically very comfortable. The spider vein treatment specifically is even less. The needle is much smaller, so it's a series of small injections. In my experience, patients are really comfortable. Usually we're just having a conversation, chatting, and they don't even realize what's going on. So nothing that's too painful.
Great, that's good to know. And with spider vein treatment, do you typically find that it's patients can get their issues resolved within one treatment session, or do they have to return multiple times? Does it vary? What do you see there?
Definitely vary between patients. Spider veins specifically often will require more treatments. The larger varicose veins, often just one treatment for those veins, especially when we're doing it for symptomatic relief, is usually all it takes. Over time, it's not common for these veins or the treatments to fail, but sometimes over time you can just develop a similar process in other veins. So, maybe we treat a patient now, and in 5 years or so, they may have recurrent symptoms. So sometimes what happens is other veins that previously were healthy have the same process as the veins previously treated and become leaky and inefficient.
Okay, very good. Thank you. Next question here for you is, how long does varicose vein treatment last?
Yeah, and kind of what we just were discussing, and the treatments that we do typically are good for quite a while, fortunately, but it's not impossible for new veins to kind of take the place of these old veins and become leaky and inefficient. So I always tell patients, if they're satisfied after treatments, that just see us as needed, but if in the future they have symptoms that remind them of what they felt before we treated the veins, to come back and see us so we can reevaluate what's going on.
Right. And I think I heard you say that many or all of the treatments for varicose veins are available right there in the office in State College at the Park Avenue location.
Yes, we're really excited that they're all here in the office. Again, these procedures are minimally invasive. You bring yourself here, you drive yourself home, you can go back to work, back to normal activities. There's no downtime. It'll take less than an hour, and it's a very exciting thing to be offering.
That's great. And the symptoms that we talked about with varicose veins, once you have treatment done, is symptom relief immediate, or does it take a little while for that to be resolved?
Yeah, so we hear that question a lot too when we're talking about performing treatments on patients, and
Mhm.
it's not immediate. And I often tell people that they might feel a little bit worse before they feel better, because anytime we do a procedure and some manipulating, it might be a little sore. But typically within a month to 2 months, patients come back and they are feeling much better. Their swelling's improved, their leg heaviness is improved, and the varicose veins typically looks dramatically better pretty quickly. So it's nice to see those results in a short period of time.
Yeah, very good. Thank you. Well, it looks like those are all the questions that we received for today. Just wanted to check to make sure we didn't get anything in here live. Is there anything that you want to share with our viewers, Nicole, before we sign off here today? Anything that you did not get to talk about regarding the clinic?
I think I covered everything. So we're really excited that we're able to now provide these expanded services to the community, and we are taking COVID precautions here at Mount Nittany. So we are seeing consults where we are taking all the precautions as far as social distancing and wearing masks, thorough cleaning of rooms in between patients. So I think patients can feel safe coming here. We're happy to see patients, and please, any questions, concerns, anything you would like to ask us or schedule an appointment, again, you can call the office or email us.
Okay, very good. And like I said, I will be sure to put that contact information in the comment section below. I should also mention that you are joined at the Vein Vascular Clinic by Christopher Jones, MD, right? He's the other provider. He joined us on a virtual tour segment a few weeks ago to look at the cardiac catheterization labs at Mount Nittany Medical Center. So he's
check out his video too.
Yeah, that's right. That's right. So he's been a guest of ours as well. So, well, thank you, Nicole. It's been a pleasure. That was really helpful information for our viewers. For more information about all the services that we discussed today, again, you can see the comment section below, or you can visit mountnittany.org. And for our next tour stop, we have a few more left here as we finish out the year. Please remember to follow us on our Facebook page. Thanks, everyone, for tuning in, and thanks, Nicole, for everything you do. Thanks for being here.
Thanks for having me. Thanks, everyone.
Thank you. Bye.